Hello everyone, we are at ICM 2025 and in RGC International Joint Center Corner, and I am with Dr. Budhiparama. Welcome.
Hi, welcome.
Could you please introduce for yourself for our audience?
Yeah, I'm Professor Nicolaas Budhiparama. I work in two places in Indonesia and also the Netherlands. And currently, I'm the president of Asia Pacific Orthopedic Association.
I have some question about the ICM, of course. What the ICM means to you?
It's a lot, you know, because I was also attending the previous ICM, and it's a very important is that if you can see here, it's gathered all expert, the top expert all over the world. And the mission is one. We share the missions that to improve patients' care by establishing global evidence-based guidelines, which is for the prevention and for treatment of PGI, which is very important. And what makes it difference is that, you know, like in another consensus, it's usually local or per countries or regions or name it a continent, but this is for the whole world, so it makes pretty much different.
Yeah, you already answered my questions. And how can I say this? Why the infections matters for you?
Yes, it's a good question because you know PGI is a disaster as well for the doctor as well for the patient, and also it costs a lot of money and very frustrated once you got these infections. And here we show that what we ask about how to prevent it from all over the world, because you know the perceptions may be different in the east and the west country, for example. So we get together and we have one conclusions on it. So it is that's why though that it is very frustrated, but how to prevent it, this is the most important thing, I think.
Out of the topic, I want to ask a question. Who is the Scotland individual you send us?
Excuse me?
Scotland. That you send the videos, right, for the ICM?
You mean the how do you call it, the Instagram?
Yes, yes.
I think I'm. Thank you. What is your name? Ausra.
Yeah.
Thank you, Ausra. And as you might know,
Yeah.
I think my Instagram is the most who being liked, right? I saw that.
Yeah.
And it is something pretty much different, and that's what I love. Jay and Torsten's, you know, because I'm in the executive committee as well. So he works very hard. So we have gathered to almost once a month, once a week. We email each other he's very committed, and that is the reason when you ask me to make an Instagram. I think it has to be one of the best, because you know this meeting is one of the best in the world, right?
Yeah.
Because they're very committed, and it means a lot, as well for the surgeons as well for the patients.
Okay. Is there anything you want to say?
I think this is the guideline for the world. So please, you can use these guidelines for the whole world if you might face PGI problems.
Is there any message for young surgeon?
Oh, that is a very important. That is a very important question, because sometime you know when you are a young surgeon, then your senior say it like this, and you don't dare to say anything else, right? You have to follow. But now with these guidelines, the world guidelines, then you know, hey, excuse me, my boss or professor or whatever, you look at this is the guideline, what the whole world are together to make this. Yes, yes. Right, yes.
We are here for this, actually.
Right.
Yeah.
Absolutely.
Yeah.
Absolutely.
Thank you so much for your time.
Thank you so much.
Thank you.
Appreciate it.